We asked the 999 operator what happens when the 999 call comes in and how is it handled.
So you obviously just ask them exactly what's happened, you get the address and then you take them through the set of questions where you basically determines the priority of the call, whether they'll be receiving an ambulance or a call back from a clinician. And then once you've gone through all the questions, it will take you on to the instructions that you need to give. So for example, like I was saying, unconscious patients, you need to maintain their airways, or people in cardiac arrest, obviously you give them CPR instructions, or if patients are bleeding, you give them bleeding control. And then you take the patient's details and then you tell them what response they'll be getting, so how long they'll be waiting, if they'll be getting an ambulance or a callback or a local service. And then you just obviously advise them that if they get worse in any way to call back, so that we can make sure that we still have the most appropriate help arranged.
We then asked what's the most common emergency calls they've had to deal with.
Falls, chest pain, a lot of mental health calls, but yeah, a lot of falls, RTCs, so a lot of these sort of not as serious calls.
I think the most common, we get a lot of patients experiencing chest pain. We get quite a few falls, quite a few RTCs, car accidents. Yeah, I think I mainly get falls. I seem to get a lot of those. I think it's less common to get cardiac arrest. I haven't had very many cardiac arrests since I've been here. I think I've only had probably about 20, so it's not like which I think is a good thing, because obviously it's not too intense all the time. You know, you do get a bit of not like a break, but some calls are a lot more easy to manage than other calls, so that's important with taking calls.